Well, let's follow up now on the confusion or contradiction of the overall messaging on vaccines. I'm joined by three members of Parliament. Steve MacKinnon is the Parliamentary Secretary to the Minister of Procurement, who's responsible for the vaccine supply in this country. Eric Duncan is the Question Period Coordinator for the official opposition Conservatives. And Don Davies is the health critic for the NDP. Good to see you all, gentlemen. Thanks for being here.
Good evening.
Steve MacKinnon, let me start with you. The Prime Minister did his best today to set aside any concerns Canadians might have over vaccine safety by saying he has no regrets for taking the AstraZeneca vaccine. Full disclosure, I have had it myself. But the Prime Minister telling Canadians, look, get vaccinated as soon as you can. But the fact is, the panel of expert advisors is telling Canadians AstraZeneca and Johnson Johnson, not the preferred vaccines, and that some Canadians shouldn't rush to get them. Why isn't there a uniform message coming from the Government of Canada and the experts on vaccines?
Well, there is a uniform message coming from the Government of Canada, and that is that the portfolio of vaccines that we've assembled is safe, it is effective. That has been confirmed by real-world clinical trials and then, of course, real-world application. And if you've had it, Peter, and the Prime Minister have had it, that makes three of us, because I also have taken the AstraZeneca vaccine and was very grateful to have gotten it. The fact is that we know that these vaccines show us the end of this pandemic. We know that where they have been, where we have been inoculating millions of people, that they have been setting this disease back. And that is what we want. That's what we're going to continue to do. And we will do that with all of the vaccines available to us, all of which, again, have been judged as safe and effective.
Mr. Duncan, if there is a communication problem, how do you fix it?
Well, good question, Peter. And even I'm finding a lot of frustration. I think this is leading some Canadians to have vaccine hesitancy whenever they have the panel come out in the morning, and then in the afternoon, the Prime Minister and others and the Health Minister are saying different things. A few days ago, it was take the first vaccine that's offered to you. Now we hear in the second answer and question period today, the Health Minister say, well, check with your physician. I can't wait to get my vaccine. I know, and it's great seeing the photos of more people in my riding and region getting them as well, but it's very frustrating to see. There needs to be one clear, consistent message from Health Canada, from the leadership of this country about what to do, and not coming out contradicting, creating confusion, clarifying later that day. And Peter, this is not the first time it's happened either. I keep saying you learn from your mistakes. And I feel like time and time again when it comes to this, we're repeating the same mistakes over again of not having the federal government give a clear direction and leadership on this.
Mr. Davies, how big of a problem is this messaging on vaccines? And if it is a problem, what does the government do to fix it?
Well, it's certainly a problem. I'm hoping it's not a huge problem. And, you know, this isn't the first time. I mean, of course, I'm on the Health Committee, and so we've had NACI appear before us on a number of occasions. And quite honestly, about a month ago, they had very confusing messaging on AstraZeneca. In fact, they changed their position 3 times in the space of 14 days, and that's not helpful. I will grant this to Steve. I think the government has been consistent in their messaging. I mean, their message hasn't changed, which is take any vaccine that comes to you and they're all safe. And I think that's true. What is confusing, though, is when the NACI, upon whose expertise they rely, when they give contradictory, changing, and confusing messaging, right. That is a problem. And I don't think the government can have it both ways. They often will tell us, rely on the experts, listen to the science, don't second guess their judgment. But I think Canadians are legitimately confused right now when the national group that's advising on immunization is changing their position and giving contradictory information from that of the government.
There's a lot of experts on this across the country, and a lot of them appear on this channel and other channels on an ongoing basis. And largely the messaging is the same, but there are sometimes different messages. And Mr. MacKinnon, I guess I'm wondering, is this competing advice on vaccines, or at least differences of opinion on what vaccine to take, is it necessarily a bad thing, or is this the result of bringing lots of advice, contradictory as it sometimes might be, to the table and promising a transparent vaccine process?
Well, again, I'm going to belabor this point for a moment. The fact is that these vaccines are safe and they're effective. We see in the UK, which has virtually relied solely on the AstraZeneca vaccine, we see the results it's having there. We see the results that other vaccines are having in other jurisdictions. So we have the best possible evidence, because it's right before our eyes, that these vaccines show us the way out of this pandemic. They keep you from getting sick. They keep you from going to the hospital, and they should be taken just as quickly.
Right,
as,
but I guess what I'm asking
to
is this what you get if you want an open process? You're going to have some experts saying,
Indeed.
you know what, there's a different way to do this. The alternative is to say, Nassi, thanks for your time. We don't need your help anymore. We've got a communication policy here. Stand down.
Well, we're imposing a rigor on these processes, which are all, of course, unfolding before our eyes. With the miracle of modern science that is immunization, that is vaccine, is of course, an evolving one, because we are getting real-world, real-time data every day. Being put through the filter of the entire world's media, and that's being interpreted, as you say, Peter, by dozens and dozens and dozens of experts. So at any given time, of course, you are going to have someone saying, someone offering an interpretation that may be a shade different than the other. The important thing is, I do want to stress this, because this is very important. People watching this channel take these things very seriously. The Canadian regulator, Health Canada, which is among the world's finest regulators of vaccines and pharmaceuticals, has ruled that these vaccines are safe and effective, and you should take the first one that's offered to you.
All right, Mr. Duncan, do you think we need Nassi? Do you think we need experts that at times may have a different point of view on the safety of a vaccine, or the application of a vaccine that's different than others at Health Canada?
We need a clear communications plan, Peter. That's what we need. And I'm going to say on
But to
here
get
on the
that
record,
clear communications plan, do you tell the Nassi people, we don't need your advice? I mean, they're going to speak out. That's their job.
Well, there should be, but again, in different organizations, you have how the information's filtered and what is said and communicated on this. And again, I'll take the line here. I think all three of us and our respective parties want people to take the vaccine. We want to get past COVID like everybody does. But what this does is contribute to the chaos and the confusion. We've seen this before. So there needs to be one voice on the issue, speaking to Canadians about vaccine safety and the recommendations, period. Not having to come out one morning a recommendation, and the government says, listen to the scientists. This is a panel of scientists and experts come out and says something. And the government says, well, don't really listen, or talk to your doctor, and it creates confusion.
Okay, but I'm still not clear. Would you shut down the Nassi folks? Would you tell those experts, no more news conferences, no more giving your opinion, leave that to Health Canada?
Well, I would certainly say if I were the minister and the department in the Prime Minister's office, I would be meeting with them and saying, look, this is not helping to getting more Canadians' confidence in getting vaccinated. We need to come up with a clear communications approach, one way, one message, one voice. How you get to that at the end of the day, that is inside baseball or internal. But there needs to be a clear message. How that comes, Peter, I think we could take a look at it. We can do better on it for sure. Okay,
Mr. Davies let me jump to Mr. Davies. Is Nassi performing a useful function, or is Nassi getting in the way?
I think a bit of both. I think they have played an important role. I mean, this is the National Advisory Committee on Immunization. They existed before the COVID crisis.
They're made up of infectious disease experts, pharmacists. They're a broad group of experts that have been, and it's voluntary. They've been called upon to advise the government.
Yeah, and let's face it. I remember about a month ago, we had three different federal appointed bodies. You had the Canada's Chief Science Officer, Dr. Mona Nemer. You had Health Canada, and you had Nassi. All say three different things on AstraZeneca in the course of a week. And Dr. Mona Nemer, I thought, hit it on the head when she said, what we're doing in some ways here is we're conducting a population-level clinical trial. And I think that's true to some degree. The truth is that we don't actually know. We don't have hard answers on things, and so we go with the best evidence that we have. I personally think a little bit of diversity of opinion is healthy. Let's face it. It depends on your tolerance level. Nassi's pointing out that there are issues with thrombosis with some of these vaccines, and we're not exactly sure what the rate is. Overall, I think there's a consensus that it still is vastly preferable to take the vaccines, considering the relatively rare risk of blood clots. Okay. So that is a message, but I think it's helpful for Canadians to have informed consent, to know that that is a risk. And in a democratic society, sometimes you just have to respect that there's different opinions on things. But definitely, we should have a clearer voice coming from the government speaking, I think, to Canadians on such an important issue, and we're not hearing that.
Thank you all for weighing on this. Time's short tonight. Thank you all for weighing in on this important conversation. And it's a big decision for a lot of Canadians to have to make, and they're hearing lots of different information. So we'll see how they absorb that. But thank you all for your perspectives tonight. Good to talk to you all. Take care.
Thanks, Peter.
Thank you, Peter.